It's exciting because it's implementing a progressive future for a country community.
When you're trying to stabilize the local healthcare system, it's critical to have a liaison to facilitate that engagement with the community. With that community champion, they're out there, they're the boots on the ground, helping to understand those needs that are not related to just clinical care alone.
My job is to connect the hospital with the community and the community with the hospital. So, whatever that means today is what I do.
In my average day, I spend a lot of time communicating with those in our community who we've kind of signaled as the primary community partners.
I have established some very strong relationships where I can pick up the phone or I can go to their office and say, hey, this is what I need.
Healthcare is evolving to where there is more of a focus on population health. And that involves looking at those social determinants of health, which is why you have to collaborate with community partners to address the total person, to address population health altogether.
I feel it's very important as a rural community for the hospital to be engaged in the community, just to help the community understand what resources were available to them, as well as have the knowledge that not just the hospital, but all community partners are available and that we should be working together for the greater good of the community.
That's what it is all about. And so that they can get the needed services, especially health services that they need.
We help them to understand what it means to be a facilitator and hearing all voices throughout the process.
It was really cool to see all of those who were there and participate, and to be able to come to an agreement on the top 3, and then we were able to narrow it down to the top priority. I felt that I had accomplished something.
When we do the work, when we sit down and we work together, we actually get actionable items, we move forward, we make a difference.
So we have different boot camps that provide this types of training. We also provide them training with understanding data, their community health status reports, and how they should keep their eye on that and how that evolves and helps to inform the plans that are developed. And this training just continues throughout the 3-year program period. But by the end of the process, our champions are strong facilitators. They understand data, and they understand the importance of keeping community partners involved.
The center was very helpful and still is very helpful. Readily available whenever I needed them. They did practice runs with me, constructive criticism. They tell you don't be afraid to reach out because, they want you to look good, and they're there to help you. And they taught me so much.
I'm always trying to make a difference. So with taking this position, it's like I have the opportunity to make an impact, a positive impact on my community.
You've got to be a go-getter.
You have to be creative, you have to be motivated, and you have to seek out those relationships that can catapult you forward.
I've developed friendships that are going to probably last me my entire life, and so I'm really grateful for that.
I'm educating those that I come in contact with, and I'm in healthcare. So it's perfect. It's a blessing.